So welcome everyone to another episode of Lessons from Leaders. And I am very honored to have Dr. Rehana Ahmed with us today. She is in Pakistan right now. So you'll notice some of the sound and maybe the video will be a little delayed. And that is okay. We are so grateful, Rehana, that you're here. So any difficulties technically, that is no problem. And she has such a wide background. She is a medical doctor. She's been very instrumental in working on reproductive health in Pakistan and elsewhere. She is currently, amongst her many things that she's doing, she's an advisor for WHO. She's on the board for PS Kenya. She founded some organizations in Pakistan. So I will welcome to you, and if you would start out by telling us a little bit about your background, which will be way more interesting than me explaining it.
Thank you, Lynn, for inviting me to this interview. It's a privilege. It's an honor and privilege for me. As you pointed out, I am a medical doctor, and most of my experiences are from that background. And as I should begin, when I was an intern, what happened was that the very first emergency case that I admitted was a botched-up abortion. And the young girl, despite all our efforts, she was only 16 years old, she died. That left a huge impact on me. Subsequently, a number of women came in with different complications, all related to delay in seeking care, and also not getting care in the community. So these were women who came with uncontrolled bleeding, with severe infections, and even convulsions. So it was very clear to me that there were missing pieces in our care, in our community health system. And where, while these women were suffering, it was something that needed to be prevented. Prevention was something that was not being talked about, along with having poor services or lack of services. Then as I moved from the internship into actual clinical practice, I came across the same problem where women came in with unplanned pregnancies, and we counseled them, and we tried to ensure that they got contraception so that the pregnancy would not be, the next pregnancy would be delayed, or there wouldn't be the same issue of unplanned pregnancy. I recall one woman was so grateful to me that she named her baby girl after me, calling her Rehana. Further on, the clinical practice grew, and the clinic itself became quite popular. And WHO, World Health Organization, included it in the feasibility studies it conducts in different countries on new contraceptives. In this case, the implants, those were coming in, and we were part of the study. Medical students and nursing students would come to our clinic for clinical training and family planning, because we had the critical mass of clients coming to us. And then at the same time, NGOs and donors would stop by on their visits, and they found this a center of excellence for training of medical professionals in this particular area, which was really not being focused on in the larger hospitals and larger settings. So this clinic became very popular as a result of that. Then in 1991, something interesting happened. Population Services International, which is called PSI in Washington, they came by to Pakistan and founded an NGO, a non-governmental organization, and formed a joint venture for social marketing of condoms. Now, that joint venture also took off very well, and it was for family planning. It was at that point, a few years later, that I was recruited by this joint venture to add female methods of family planning. Now, interestingly, for female methods, you can't sell them just over the counter. You do need a provider, and it has to be a trained provider. At that point, when I joined, I had a team, a dedicated team, and we now pursue training of these providers and formed a very large network of reproductive health providers. Now, these were existing clinics. So what we did was add the preventive service and supported them in being able to give a quality service to the low-income women. So that's how my background has shaped out, and with all these events that took place along the way.
And so you were impacted early in your career by the experience of the young woman, the young girl, actually, she was only 16, dying. And then, so in my mind, that you have a focus that you've stuck to, that you've been loyal to all this time, trying to make inroads, make change with that, with that focus, like you've cleaved to it. Does that feel like that for you?
Yes, absolutely. I have. I actually fell in love with the poor women of Pakistan because they were so powerless, and any help one could give them was really appreciated, as I said. And just giving knowledge was not enough. You also had to give them a service, a quality service. And I think I realized that just increasing access and making it available to them was a huge service that was needed,
right,
to prevent all the complications that I had seen in my earlier years.
And so all these, I can only imagine the challenges and obstacles that have come up over the years. What lessons have you learned from them? How you handle them?
There are several lessons, and it really is. I think it's so complex because it's not just service delivery. It has to be at all levels that we need to take action. And again, politics is very critical, because we do know that many countries have succeeded, and they've succeeded only when the political will has been brought into play. It's then that the resources are made available and systems are put in place. So developing countries where the systems are weak and the resources are meager, I think the low-income women do suffer immensely. And so the lesson learned is that the social indicators have to be improved. And it cannot be in a silos. You do need women's education. You do need women in the labor force, so they become economically more strengthened to be able to take some decisions themselves. So giving power to the women is a big lesson that one can learn. But even while all that is happening, we can't really wait. We have to move on and ensure that we prevent all these unnecessary deaths and morbidities that take place as a result of unplanned pregnancies.
Don't you have a personal philosophy that, Rehana and I spoke before, full disclosure, and she was telling me that she sees challenges, or you see challenges, as either a mystery or an obstacle.
Absolutely true. I categorize them because you see, challenges are always there, And how do you tackle them until and unless you have not analyzed what it is that's coming at you? And I give you a more recent example when I'm a chair of a board and I'm on other boards as well. When one of the directors took it into his head to say that there was a conflict of interest because I was on two separate boards. And despite the fact that both boards did not see it as a conflict, he went ahead and reported it to the regulator. Now, it required very strong action on my part to get that dismissed.
Mm-hmm.
And then at the same time also get the director to step down for the disruption that he was trying to cause. And did that without affecting the work of the organizations. So that was an obstacle, clearly, and it had to be removed. So you see, your action comes after you've decided what it is that you're tackling. But to me, I think the biggest mystery challenge is why women don't use contraception and opt for abortion. To me, that's a mystery that needs to be solved, because it just shows that we have not understood the pain she goes through, the fears that she has. We have not really understood that. And that until we solve that mystery, we won't be able to get women to use contraception, which really is the need, because we have large youth population, young people, women under 30, and nearly 50% of these women, married women, are not using contraception. And we know for a fact that if a couple doesn't use contraception for a year, there's bound to be a pregnancy.
Right.
85% end up with a pregnancy. And if it's an unplanned pregnancy, then we know that either they go in for an unsafe abortion or they have many children. And both are really not optimum outcomes to their life plans.
Right.
So really, challenges are there, and we do need to categorize them, and we do need to then take actions accordingly.
I love the mystery, though. I love looking at things as a mystery. In some ways, it brings curiosity then. It brings, I don't know if it feels playful to you because you're dealing with these weighty issues, but it feels more playful to me. Like, how can we unravel this as opposed to a wall or an obstacle? It feels like we can figure this out. We just don't know how at this moment. So I wanted to highlight that for everyone who's watching or listening, to think about when you come up against things that are getting in your way, or is to look at it as a mystery. I think it shifts the perspective. So, do you have thoughts on that?
It's true. I think the mystery could be diminished if women were educated and could step out and solve the mystery for themselves.
Oh, that would be...
And that is something they could access whatever they required. However, given the current situation of the low-income women and the lack of power that they have, I don't see this happening very soon. So we just have to keep trying to understand and hold their hand while we take them through this process of understanding the need for prevention, rather than putting themselves at risk.
Right.
And it is very high risk. The unsafe abortions really are rampant. Nearly 3.8 million unwanted, unplanned pregnancies taking place every year, all because of, as I said, less than 50% women using contraception.
Right.
So it's a large number to deal with. Yeah. And so knowledge alone is not enough. We also need services. So it's a whole continuum that is required to assist in this festering problem that's currently our problem in Pakistan and in several developing countries.
Right. Not Pakistan doesn't stand alone in that. Yeah. So let's talk about failure, and what are some of the what have you learned from failures that you've experienced as setbacks or when things didn't go the way you thought that they should?
Well, I think my biggest concern is that I was off course at one point. In my clinical work, for example, I would help women begin contraception, and invariably they came back pregnant. And that to me was huge failure. So I began investigating what was happening in the community. And I realized that the private clinics, and we have a mixed health system, so there are a large number of private clinics. The providers had a fear of contraception or did not understand it. And if a woman did go to them for anything, any ailment, even if it's a earache, they would say, stop the contraceptive. That was the advice. And the end result was that the woman would come back with a pregnancy. So very quickly we realized that our failure was the health providers' lack of knowledge or incomplete knowledge and lack of skills. So both needed attention. And fortunately, with the social marketing group that I joined, we were able to address this to a large extent, because for female methods, you do need the provider and you need a trained provider. So we were able to get the private clinics into networks, and we formed what is called a social franchise. Now, interestingly, social franchise is like the Uber of family planning. And that is, you don't own, the NGO does not own any of the clinics, but it supports the clinics ensuring that they have the contraceptives and they are trained by the clinic, so that the access and the quality of service is such that the women who do come to the clinics benefit from it. And social franchise is a business model. We see that in the commercial sector. But using it for health and family planning has been really one way of expanding access to quality services. Fortunately, the large anonymous donor that we have, and also the German government donor, Development Bank, KfW, they understand the need for the provider and client relationship to be strong, in particular in case of services like family planning. So that can only happen if there is a stationary clinic or available provider who is trained and able to counsel the client and is able to hold her hand through the initial phases, if she has any side effects or any problems and so on. So it works very well, and it's easy to replicate. So what once it was successful in Pakistan, we were able to also take it, I was able to take it internationally. I moved to Africa and was there for 14 years in East Africa, and I was able to help Kenya set up their, PSI set up their Kenya franchise. And then other NGOs, Marie Stopes began franchise in 17 countries, and their flagship brand is called Blue Star. And then in Kenya, again, for HIV/AIDS, there's a private providers network which we help design, and that's called the Gold Star. So all the branding that takes place helps to popularize to the community the service that is available. And it helps you to market a large number of clinics, because if the brand is there on several clinics, then you're just pointing out that all the clinics with this particular logo are offering the service that you have trained the provider for. In our case, it's been largely family planning, reproductive health. In Africa, it's been about HIV/AIDS. And so the franchise model is replicable. The franchise model is also, once you give it support and you maintain the support, you can also ensure quality. And it gives ongoing contact to the client to be able to keep going back in case of any problems.
So I'm listening to you and listening to the obvious passion that you have for this and the commitment, and you've invested, your life's energy into it. And I'm imagining the challenges that there have been for you to be working in this sector in Pakistan or in East Africa. And so what's coming up for me is your own courage, like to be a leader as you have been, and in a sector that's not probably always welcoming. Where do you think you've shown courage, and what does courage have to do with it?
Oh, I think it's required every day. Courage, I think, in the development sector itself is a daily requirement. Mm-hmm. Of course, courage comes in different forms, but in our field of work, courage is required to stand firm. Exactly as you said, it is not an area where many people have ventured and spent their energy in, because if this was a prestigious area, I'm sure, as is surgery or as is any other branch of medicine, then people thrive and become very strong in that. Family planning actually has not been given that, importance. Mm-hmm. In medical education, in nursing, and so on. But it is a huge social problem. It is not just a medical problem, because it is a behavior that needs to be changed. So we're not really selling contraceptives. We have to sell family planning, the idea of family planning. And it's usually confused with selling contraceptives. Well, that's the tool. But the idea has to be accepted first, that you do want space, you do want healthy spacing and healthy timing. So courage is required in every way. In my case, I think courage was required for the resources and with people. The human resource in this area is really, the trained resource has to be dealt with very well. And I found that people who were not dedicated, just let them go, let them do whatever else they want. You can't really hold on to them. So letting people go. And then again, these areas of work are funded mostly by donors. So donor funding is, as I said, resource, is something that is quite, uncertain. There are periods when it can dry up and you have to close projects down. So you have to let staff go. And that requires a lot of courage because you're making people jobless. Mm. At the same time, those who are left behind, you have to deal with them. They are like a defeated army. Mm. And you have to keep them motivated to continue working. So this is an area where I think the courage comes from dealing with the uncertainty of resources, both financial and human resources. And you have to maximize your impact through very creatively. It is not like there's a steady revenue and there's steady income and you can have a profit. All that doesn't work. Because the input is donor money and the output is a societal benefit, and yet governments don't have the funding resources to fund the preventive side. Mm-hmm. The curative side is revenue generating, so that's much easier. The preventive side is really a public health issue, and that tends to be left on the back burner very often. So courage is required to deal with the projects, and courage is required, but you at the same time have to be gentle and transparent about it. And I think it's a daily requirement in our work.
What is the phrase that your mother would say that you remind yourself of?
Yes, she would call me Meri Bahadur Beti, which means my courageous daughter. And she invariably, when I would tell her my issues and problems, she would encourage me to be steadfast and take the right decision. One of the things she would say is, don't procrastinate. And I found that very useful, because you do have people to deal with people who are not productive. Then it's not really good for the organization. You should let them go and keep those who are committed and willing to work with you as a team. So really, largely, it is to do with taking timely action. It is largely to do with taking decisions. One of the things I've found very often is that people take too long to decide. And now there's no right or wrong decision. You have to take a decision and move on. And that's where courage is required. You can think about it, but you also have to bring it to a close. And closure is not easy. It requires a lot of courage. Often you have to give bad news, and you have to put on your professional face and go and do it, even though you're quaking inside. You know that it has to be done. It cannot be put off. So you can't really be like an ostrich. You have to face it squarely and get on with it. That's the courage in the development area.
And I like even though you're speaking inside, because I think some of us may think that courage means that you're not quaking inside, which is not the case. You know, you still move forward, even though you're thinking, is this the right thing? Are they, if you're letting people go, how are they going to react? But you believe that you're doing the best that you know, and you go ahead, even though you're quaking inside. So I'm glad that you said that. And I also just so honor your mother for saying to you, my courageous daughter. I think that is just fabulous that you have that in you, that you can carry that with you. Your mother's voice saying, oh, you are my courageous daughter. It's quite moving to hear that. I also am very curious as to what advice you would give yourself now, knowing how you've come so far, you've accomplished so much, you're closer but not exactly where you want to be in your goals. So looking back, what do you wish you knew then when you started that you know now?
I feel that I think the best thing I did, and I continue to I continue to tell anybody who wants my advice, is invest in yourself.
Mm-hmm.
Invest in yourself, because you see, if you do that and you keep yourself updated, what happens is that you feel good about yourself, yes, but at the same time, you become a leader in your field of work. And I didn't know that in the beginning. I just went ahead and I read everything on family planning that I could find, and there wasn't very much. But it is something that I have always done, is kept up to date with all that's going on in the field that I'm working in, from various angles, from various points, not just the service delivery, which is obviously, and training, which is my base from where I begin, but taking it into the management area and taking it further up into leadership. And at the moment, I'm chair of the NGO. I began as a training manager, and I went up and I went further after setting up the network. I was promoted to CEO of the NGO. And then when I moved to Africa and came back, I've been made chair of the organization. So I have found my way all the way from a staff to the CEO of the organization, right up to the top governance officer of the company. I'm also on international boards. So what I say to myself is that stay steady. You build a foundation, then don't move away, build the walls, build the roof, put in the furniture, and put it all together. Because currently what I find is people do keep moving, and they built a little foundation and they go away and do something else, and then something else. So they're continually making foundations, but then the rest of the structure is missing. I think that is the main lesson that I have, and that is take a decision and then go all the way, and with commitment. Because really, if that commitment is missing, then you will always be looking for something new to do. You can add other things, but don't lose your main focus. And I think I've managed to do that, stay very focused. And the end result is that as you develop, they say begin with your passion. I think passion comes further down. It doesn't always begin with the passion, but once you are working away at it, chipping away at it, the passion does develop. That's what I have learned.
Would you have anything else, like any advice to new leaders? Anything that you haven't already mentioned?
I do have one point, more than one, but I'll mention one, and that is as you keep going up your career ladder, you do need to look at the bigger picture. You do need to size up the situation. And then you may need to sometimes even step back in the face of being more useful to the organization. So your personal goals may have to take a back seat. But it's very important to be part of an organization, because your impact comes through, it is a collective impact. As a single person, I don't think you can make, people say you can make a difference. Yes, you can. I'm sure you can in a little way. But if you want a big impact, then I think collaboration, the word that I use is then collaborate, and don't think so much of competition. Keep improving yourself and collaborate. And that is something that is not happening in our field of work. And maybe it's because the donors are funding different organizations, and so you tend to look upon them as competition, other organizations as competition. I think a better way would be, because there's so much work, a better way would be to form partnerships, the government, with other NGOs, and work shoulder to shoulder, because the problem is huge. There are alarming population growth rate that's taking place in Pakistan. It's a young population. They're all coming into the reproductive age. They're all going to reproduce. And so it's going to just continue being a problem for a long time to come. So there is really the need to collaborate, to have a collective impact. And so my advice to young people is that, get together and work and collaborate so that we can overcome this big problem that we are facing as a country.
It's I in the interviews in the lessons from leaders, when I ask people what they wish they knew now that they didn't know then, one of the things they often say is, I wish that I had listened more, I had put aside my own agenda more, and that I had realized, it was working with others. It wasn't all about me making my imprint, my stamp on the world. And so I appreciate what you're saying. It isn't so much that we get to shine, that I get to shine, because that's not the goal. The goal is to have an impact on this thing we're trying to change. So I appreciate what that you're bringing that up in a different way. So we're about end of the time. Is there anything that we haven't touched on that you were hoping that we would?
Well, I think we need to have stories from our women, and we need to have role models, many more. Currently, when I look around, even my own organization, I see it's run more by men than women, and in the leadership positions. Right. And that really makes my heart sink. But then when you go out looking for the women, they have more or less given up and domesticated themselves. So you can't really get them excited about taking on these challenges. So I find myself the odd one out. I'm still trying to make things move forward as best as I can. I think we need more women in leadership positions. And that is something, and we can't really bring people from abroad to do it. It has to be homegrown,
right?
Because that's where the strength comes from. And that is a big missing piece at the moment.
That hurts my heart to hear that. And it's another mystery that needs to be solved. Why are women not stepping forward? Why are they choosing? And to me, it sounds like an easier path, because to be a leader is not, as we've talked about, it takes courage, takes commitment, it takes failing in front of everyone. When you fail, everybody sees it. So that topic in itself requires further conversation, I think, and thinking about. And I'm looking forward to hearing how you unravel that mystery.
Thank you. It's an ongoing project.
Yes. I wanted to thank you so much for taking the time to be on this episode of Lessons from Leaders, from sharing your story, sharing your deep passion for the work that you're doing, the change you're trying to bring about. And you've been doing it. This is your life's work, that you've been doing it so with such loyalty and dedication, with so many challenges. So thank you. Thank you so much for coming.
Thank you, Lynn. Thank you for having me on the program. Thank you.